Imagine, gising ka, malinaw ang isip mo, pero hindi ka makapagsalita, hindi ka makagalaw. Ito ang tinatawag na locked-in syndrome. Isang bihira pero napakabigat na kondisyon. Kaya't halina, tuklasin natin ano nga ba ang sanhi nito at may pag-asa pa bang makawala rito. Dito lang sa Doctors on TV. Ang locked-in syndrome ay hindi lamang isang bihirang kondisyon. Ito rin ay may mga kwentong nag-iwan ng malalim na marka sa kasaysayan ng medisina at literatura. Mula sa unang documented case hanggang sa makabagbag damdaming alaala ni Jean Dominic Bowlby. Tunay na nakamangha-mangha ang mga kwento sa likod nito. Alamin natin yan sa Dose of Information.
Alam mo ba, ayon sa History of Neurology, ang terminong locked-in syndrome o LIS ay unang ginamit at lumitaw sa print sa librong Diagnosis of Stupor and Coma ni Fred Plum at Posner noong 1966. Tinatawag din itong pseudocoma dahil parang unconscious ang pasyente pero sa totoo'y fully aware sila sa paligid. Ayon sa MedLink Neurology, ang pinakaunang clinical at pathological na ulat ng kumpletong locked-in syndrome ay ginawa ni French physician Camille Darroll, isang intern na pinangunahan ni Francis Damasceno na iprinesenta noong 1875 sa Société Anatomique de Paris na ginanap ni Jean-Martin Charcot. Bukod dito, isa sa pinakakilalang kaso ng locked-in syndrome ay ang kay Jean-Dominic Bowlby na isang French journalist. Matapos siyang tamaan ng malubhang stroke sa brainstem, hindi na siya nakagalaw pero malinaw pa rin ang kanyang kaisipan. Despite being locked in, hindi napigilan ni Bowlby na magsalita gamit ang kakaibang paraan. Nadiktahan niya ang kanyang memoir sa pamamagitan ng pagkurap ng kanyang mata tuwing tatama sa tamang letra habang inuulit-ulit ang alphabet. Si Bowlby ay pumanaw 2 araw matapos mailathala ang kanyang libro na may pamagat na The Diving Bell and the Butterfly. Pero naiwan ang kanyang obra na kalaunan ay naisalin din sa isang critically acclaimed film.
Nakita natin sa ating Dose of Information kung gaano kabigat at kamangha-mangha ang kwento ng locked-in syndrome, isang kondisyon kung saan malinaw ang isipan ngunit tila nakakulong ang katawan. Ngayon, mas palalimin pa natin ang ating kaalaman. Ano nga ba mga pangunahing dahilan nito at kung ikukumpara sa panahon natin ngayon, may pag-asa bang makabangon ng mga pasyente mula rito? Kasama natin ngayong umaga ang isang magaling na neurologist from Makati Medical Center. Welcome to Doctors on TV, Dr. Perry Noble.
Hello.
Hi, Doc, and welcome back to Doctors on TV.
Thank you for inviting me today, this morning, for this program. I'm always glad to help, magbigay ng information about any topic on hand, especially neurologic.
Thank you, Doc. At marami tayong matutulungan po, lalo sa araw na ito. And ito, Doc, para po mas klaro po sa lahat, ano nga ba yung tinatawag na locked-in syndrome?
Okay, yeah, actually you mentioned the essential points already of what is a locked-in syndrome. When we say a condition is a syndrome, it's a clustering of findings, no? So, syndrome, ang kailangang meron dito is, number 1, weakness of all the muscles, both upper and lower extremities, and also even the lower part of your face. So they cannot chew, they cannot breathe, they cannot swallow, no? But, however, so this constitutes another part of the syndrome. Depending on the extent of the illness, pwede silang maka-move ng eyes nila up and down. There's vertical gaze movement. And they can even blink to signify that they can communicate or that is a means of communication to their caregiver or to their family. And the other part of the syndrome, which is very important, that's why we have to recognize it, is the patient is actually aware of what's going on. So there's awareness. So it is a state of awareness characterized by weakness of all muscles, quadriplegia, and the lower cranial muscles, with sometimes preservation of eye movements. So this constitutes the syndrome of locked in. So syndrome na parang nakakandado ka, locked in sa sarili mo. Hindi ka maka-communicate freely. Somehow you may be able to communicate, but what are the means of communicating? Like right now, I'm doing it. I'm gesticulating. I'm using my hands in order to somehow point out specifically what I would try to point out. But in a locked-in patient, hindi gumagalaw upper and lower. So the means to do that is just somehow using the eyes, and the way to do it just is by blinking and by vertical eye movement.
I see, Doc. Is this rare? And how different is this from yung, di ba, may coma state or yung vegetative state?
Definitely, ang locked-in syndrome is rare. It's kind of rare. Because, I will say, what is the pathophysiologic mechanism? Bakit nangyayari ito? Kasi may isang parte ng brain, pag merong nangyari doon, and I would say, it's sa tukod ng brain or brainstem, specifically the pons, no? Pag may nangyari doon, yun ang kahinanat na nito is, of course, locked-in syndrome. So anything that may happen, but the most common cause is stroke, no? Ang stroke sa lugar na yon. A tumor may present the same. Another presentation is Guillain-Barré, which all the nerves are also affected, paralyzed, yet preserved ang kanyang mentation. So, matatanong mo, Doc, bakit preserve? Kasi ang lesion, ang lugar ng sakit, hindi nasa taas, kundi nasa tukod ng brain. Kaya somehow the patient is aware. Okay? You mentioned it, it's being rare. Yes, it's rare. Because at times, if we see patients with stroke in this area, iba ang manifestation. Pwede ng coma, pwede ng nanghina sa isang parte ng katawan. You also asked, how is it different from coma or a vegetative state? No, ang coma, mayroon tayong criteria niyan, but basically, ang coma, non-awareness talaga of self, no? Hindi siya aware kung ano nangyayari. And there may be weakness on just one side, both sides, depending on the lesion. While a vegetative state, kaya tinatawag nating vegetative, parang gulay, no? Na dinidiligan na lang natin para sila mabuhay and everything. They are awake. However, they may not be aware of their condition. So, we have to also supplant their condition by giving artificial respiration or feeding. But yet, ang kanilang subsistence is buhay nga, pero yung functioning is quite depressed, no? We need someone to take care of them.
Okay, siguro Doc, maganda rin na elaborate natin kasi isang affected dito is the brainstem, right? So basically, pag sa mga normal individuals po, ano ba ang role ng brainstem? Ano yung mga function niya sa mga normal individuals?
Okay, ang brainstem ay isang part ng brain natin, no? So, kumbaga, yan ang nagsisilbing daanan ng communication of whatever function our brain has to the rest of the body. So what do I mean like by that? So ando doon sa pons, maliit lang siyang lugar, no? Parang nasa highway ka, dadaan siya doon sa pons, no? Kung halimbawa, yung ating pag-iisip, gusto mong galawin ang ating kamay, dadaan yun sa brainstem, yun ang magsisilbing conduit or daanan para magalaw yung parte ng katawan. At the same time, if there's any stimulus coming from outside, meaning, kunyari nakatapak ka ng matusok na
needle,
gamit, karayo man lamang. So, ang reaction natin is gagalaw. Kasi dahil may communication yung ating
Lower
part of the body to the
Brain.
to the brain by interacting with
Dadaan ka nga dun sa
dadaan ka nga
pinaka...
doon na yun.
Ayan.
So, kaya importante yun. So, in almost all functions, we can say that the pons is part of the brainstem, parang on-off mechanism yan, no? Parang switch off. Na naka-on nga yan, pero kailangan mong masilbing na, sige, pwede natin paggalawan yung rest of the body para, kunyari, makakilos ka, makakain ka, magawa mo yung pag-ihi, pagdumi, yung basic functions ng katawan natin.
So basically, siya yung magko-communicate from yung sa taas para makapunta sa
Yes,
baba, yung
yes, yes.
utos mula
That's-
sa taas and vice versa.
Vice versa.
So kung yung dadaanan may problema, bali wala.
Wala.
Okay? So kaya kahit ano yung gusto mangyari ng taas ay hindi pa rin magagawa ng baba dahil
Right,
mali ang
right.
daanan.
So,
okay, so na-mention niyo po kanina yung CVA or stroke, no? Bukod po sa stroke, ano pa yung minsang pwedeng dahilan? Bakit nagkakaroon ng locked-in
Okay,
syndrome?
so I will say what is close to my experience, what I've seen in the past. It's rare. Of course, I don't have the enough statistics, but I may say I just saw, siguro, the most lang is 10 to 15 of in my neurological career, no. But ang kalimitan talaga is stroke, no. Ang pangalawa doon ay yung Guillain-Barré, no. Kasi matanong bakit ano ba ang Guillain-Barré? Kasi nerves ang napa-function. Kasi yung function ng ang nangyayari sa Guillain-Barré, yung mga nerves natin na lumalabas sa tungkod ng brain ay naapektuhan din. So, yung paglabas ng dila, tikim, pagnguya, naapektuhan din. Lower part is affected, but yet the upper part is not affected. Okay?
So basically, Doc, pag dumating ito sa inyo sa emergency room, ay medyo mas madaling yung may idea na kayo na this is really locked-in syndrome.
By the way, as I mentioned earlier, that anything that is located on that part of the pons may present as locked in. Kumbaga may tumor na lumalaki doon sa area yon. Lately, may isang staff natin sa ER, no? Ang kanyang manifestation, meron siyang AV malformation, no? Hindi maganda yung communication ng arteries and veins niya. Dun sa pons, may part na locked-in syndrome siya. Okay? Pwede ring infection. So, actually, anything that can occupy the pons may present in such a syndrome.
I see. Lalo na kung nag-i-impinge kasi sa how do you say that? Parang umiipit.
Umiipit sa mga tracks, sa mga daanan ng communication, both
Yung sinabi
upper
nyo
and lower.
kaninang daanan.
Yes,
Okay.
okay.
So, and usually, ano po yung mga tests or mga procedures that you subject the patient into just to confirm that it really is locked-in syndrome?
It is mostly clinical, no? Kasi ang una nating nami-mistake pag medyo hindi gumagalaw ang pasyente, comatose na yan, no? Pero tingnan mo kung somehow there is some means of communication or parang pwedeng maka-communicate yung pasyente sa'yo. Meaning, for example, nakatitig sa'yo tapos nagagalaw niya maring locked in. But of course, prior to that, we have to really look at the pons by way of imaging whether there's something there that is causing the damage. And especially if the type of damage that is causing is something really catastrophic, meaning like a stroke, a bleed, siyempre lumalaki yan, maaring hindi maganda yung kahinan ng pasyente natin.
Okay, and so basically, so it entails a lot of experience. Just so, hindi lang yun dun sa locked-in kasi sabi nyo nga rare, pero at least importante para ma-exclude yung mga differential diagnosis.
In fact, alam mo, over the years, ang locked-in, usually pinapatawag ko lahat ng mga estudyante ko o mga kasi minsan lang sila
Yung
makakakita
ganyan
na ganyan. Kasi most of the time when we see a patient not moving, they would really label the patient as either comatose na, no? But everything, minsan pag i-examinin mo, yung pala preserved yung ibang pathways going up and down, somehow the patient can communicate. And as permit me in saying that usually their means of communication is actually by blinking, no, nagbe-blink. So actually yan ang one way of training. I don't know if by preempting for your next questions, but that's how we can improve communication with these patients.
Oh, Oh, okay. And, pero Doc, ito, kunyari, established na talaga na this is the condition, yung locked-in syndrome. How do you go about the management, Doc?
Okay, as in any condition, we have to find out what type of illness caused it. And as I said, most of the time it is stroke. So, stroke management, no? Siyempre, control ng blood pressure, and of course, ABCs of management, make sure na adequate yung respiration, maganda yung kanyang mga vital signs, no? And most of the time, they would last longer in the ICU or in the hospital. So, care is very important, no? Meaning na hindi magkakaroon ng one of the dreaded is of course pneumonia, madaling kapitan ng infection, madaling kapitan ng urinary tract infection, tapos yung tinatawag nating vein thrombosis dahil hindi nagagalaw nila kasi nagsastasis yung ating blood doon. Tapos lumiliit din yung kamay at paa kasi hindi nila magalaw na. Tapos ang isa pa, which of course has a drastic consequences, yung pagkakaroon ng decupitous ulcers or bed sores, no?
Kasi because of the immobility,
yes,
nagkakasore na, no?
Makikita mo rin, hindi sila makakain. So, adequate nutrition, tapos adequate oxygenation. These are the things that we need to address when the patient is already in such a state, no? And not only that, I would not say enigmatic. Isang challenge is, kasi alam nila, how do we support them emotionally? No, syempre, kahit pa paano, there will come a time they will try to communicate. Dok, ganito na lang ba ako? No. So, and they are attended to with a lot of emotional lability or depression during such states. So, we have to address it. You know very well, if a patient is in such state, it will somehow affect his or her recovery, di ba?
Okay, but you mentioned about recovery. Usually, anong chances ba, Doc? Ano is case-to-case basis? Pero kung kunyari, locked-in syndrome, basically, hindi talaga siya primary na, kumbaga higher than the brainstem, cerebral, hindi affected.
Depende talaga eh. So, syempre, that first is, of course, what caused it. If it is something that can be remedied, like for example, may infarct pero hindi ganun kalaki, no? Tapos nabigyan agad ng then of course the prognosis will be good. However, for example, if it is a big bleed, no, na magana doon, no, mag-iisip-isip tayo. O kaya dumating sa state na siyempre sa setting lalo natin, yung galing probinsya tapos dinala ibang treatment doon, pagtingin mo nasa state condition na ito. So mahalaga talaga yung early recognition and proper management even at the onset, because this will govern how the patient will turn out later on.
Kasi talagang key factor yung time talaga,
Timing,
time element.
yes.
Oo, kasi 'di ba alam natin hindi pwedeng nalilesa ng blood supply to the
Yes,
to the brain.
yes, definitely. Okay.
Yeah. And usually, Doc, ano ba yung mga technology yung mga parang may mga innovations ba ngayon para magagamit para makapag-communicate sa pasyente since limited nga yung kanyang communicating ability.
I will not say meager, pero kasi nakita ko na how it worked, no. Depende rin sa gaano kagaling na caregiver at families, no. So that's why the family should be very innovative in how to deal with this, how they can communicate. Yung isang family, nagbasa-basa lang sila. And of course, I told them how to do it. No? It's tracking, visual tracking. For example, nandiyan yung alphabet. Kung halimbawa yan ang first, pipikit siya, yan ba? Hanggang sa makuha nila yung
yung mismo. Medyo mahaba-haba yung pagparagraph.
Pero pag sana yan, ha? Minsan. And syempre, di ba ikaw, katulad ng sa sign language, you omit conjunctions, prepositions, yung keywords lang. Makukuha mo na kung anong essence and gist ang gustong ipaalam ng pasyente at ikaw rin baliktad sa kanya, no? So ganun, nakukuha nila. And this refers to one Guillain-Barré patient. No? I'm so amazed talaga, ang bilis-bilis na sinabi, wow, okay to, no? And true enough, I'm so happy for that patient. This is about 2 decades ago. And he recovered from the Guillain-Barré. It was a severe form of Guillain-Barré.
So basically, yung will niya. Tsaka syempre, good that was able to meet like a good doctor like you, Doc.
Sugo lang tayo ng Diyos. Anyway, the thing is, Kasi gumanda yung kanyang, may hope siya, nakaka-communicate niya kahit papano. Ang problema kasi, halimbawa yung mga state na there's no form of communication, we don't know what's going on with.
Mahirap, Doc. Kasi ako, I remember, if I would have questions para sa father ko when he was in coma, Tay, o ganito ba?
Oo.
Tay, masakit ba? Tapos parang kailangan yun niya, pipikit, o kaya magtataka ka kasi tataas ng kilay, tapos iikot ako kasi sa kabila, wala pagana because of yung mga pagana from the insertions.
Yes.
Magkukurot lang siya dito ng alam mo yung ang hirap makipag-communicate, you know.
Ay, yun ang kagandahan, challenge here, and I've seen how, so, dapat yung relatives and the caregivers should be really very innovative and in trying to deal with it, no? In fact, yung syempre, mga basic expressions, yes, no, hiwalay yan. Ano ba ibig sabihin mo? Yung madali lang masabi na ganun. And I've seen how they worked and in patients. So, ang latest na patient ko na na-locked in is actually a big bleed in the pons, no? Actually, halos sinintensyahan na pangit na pero nag-recover unti-unti hanggang sa nakita. So it depends, no, and I can't say that there's no single factor, but over time, syempre nasa hospital yan, makikita mo kung may chance itong pasyente o wala, no?
But importante yung sinabi niyo kanina, it entails a lot of love and dedication on the
At
part of the
ang kalaban natin, of
caregiver,
course, is setting in of complications. That
Ayan,
is something.
nakikipag-unahan tayo sa complications.
Usually, yung something that really prohibits us from being freely doing a lot of things because at times, may complication na may mangyayari. And some of our patients, syempre, pag elderly na, have comorbidities already. So you don't know what to prioritize. We know what to prioritize, but syempre, we try to balance in financial capability.
Yeah, kasi it would be for long tapos sa ospital. But wait, Doc, could that you mentioned about yung usually may comorbidities na, does it mean na usually talaga itong may mga locked-in syndrome would be nasa may mga older age bracket already?
So far, I may say the probability is higher with older age bracket because the more the tendency, they may have the risk factors for developing it. For example, more probability of having stroke, probability of having a tumor. So the higher probability, no. But it is not by theory. Even younger it is possible, no. Okay, offhand I cannot remember the young. Only in her second decade yung patient kong may locked, and then ito yung may malformation sa pons na initially hindi maka-communicate. Hindi niya nga alam kung ano nangyari, but later on nakaka-communicate siya.
So it really depends on the cause.
Yes, the cause.
Okay. And ito, Doc, dun sa mga nakita yung patients na ganito, parang yung bang kanilang mental health has been affected also?
Oh yes, kahit nga tayong hindi masyado nagkakasakit, may mangyari lang, lalo na ngayon, dahil mong naririnig na chismis, naapektuhan ka. How much more for them? And they are shut off already with what's going on with them. And the more napapansin ko, lalo na sa mga pasyente, the mere fact they don't know what else is going around in the world depresses them.
Yeah, pero parang mas nakaka-depress kapag alam mo yung makikita mo sa labas.
Pero yung iba nga, ano ba nangyari kay ganyan.
Yeah.
So, syempre, it's a balance of things, no? Ang laking tulong ng pamilya at ng caregiver to really communicate, and of course, with the medical caregivers also, to see ano ba ang type ng personality ng patient, what would fit best, and then adjust to his or her condition, no?
Okay.
So, as you say, always individualized, no?
Yeah,
What works for Maria won't work for Pedro, what works for Pedro will not work for Juan.
Yeah, it's really parang mag-customize, personalized. Pero Doc, apart from dun sa sa role ng caregivers and of course the family first and foremost, are there some community organizations or support groups that that help these locked-in syndrome
I'll be
patients?
honest with you, since it's rare, but I know very well that in the States they have a locked-in syndrome association, no? So, but this is through Zoom. You can communicate. And ang kagandahan naman lang nito, like with any support groups, is that you share your experiences, you share what is good experience and bad experience, what didn't work and may not work also for your patient. Parang nagbibigay ng tips, no? So, ganon. But of course, what may not have worked with them may not necessarily
Just
work.
like what you said a while ago.
And of course, keep abreast of the newest, how do you call this, technology. I hate to say, I'm not a rehab specialist, but with regards to this, but I've seen this, of course, with the advent of all these medical series on TV, nakakita ko ng mga certain gadgets that will be helpful, no? For example, with such a state na they can somehow link yung kanilang blinking to the computer to give a message to the, that is something beyond our...
Kasi this is AI era already, you know? Ay, mga Gen Z, di ba, Doc? Pero I mean, that's something to look forward to. At least this is
I
giving
saw
us
that
hope.
Wait. Iilan lang naman ang series. Pero, however, isa sa mga series na yan, na gano'n, Grey's Anatomy, no, not Grey's.
Medyo matagal na rin ang Grey's Anatomy eh.
Nakalimutan ko pero naalala ko, oh wow, okay.
Kaya lang kasi siguro magiging challenge with locked-in syndrome. Like for example, for AI kasi, it works like by interpreting yung mga results. However, if this condition is really rare, wala tayong masyadong parang information na i-input sa sa codes. That's why mahihirapan si AI mag-interpret. Siguro this might work for other cases but not, siguro baka later on pa ang locked-in since koko-onti pa.
Yeah. I may say so. But,
medyo nakaka-relate ako ng konti kasi nasa robotics yung aking kambal. So parang namimili kami ng kaso na pwedeng gawin. However, pag limited yung cases, wala kaming maibigay na data. Yun pala, database. You call it database. Walang ma-interpret. But this is one is a good, parang good thing that you raised, no? Pwedeng i-consider para to help our patients who are in coma later on para matulungan po sila makapag-communicate pa, no? Lalo na yung mga, probably hindi yung mga coma talaga eh. Those who are like yung may motor issue
may somehow deprived yung kanilang motor activity but yet their consciousness is preserved.
Yun, perfectly said. Okay, Doc. So ito, Doc, siguro parang mas maganda gawin na lang natin preventive measures. Iwasan natin magkaroon ng brainstem stroke. So, Doc, any inputs po para at least maiwasan
this
ng
goes
LIS?
for any stroke for that matter. Siyempre, ang stroke ay isang condition that can affect any one of us, and there are modifiable and non-modifiable factors that may predict a patient developing stroke. We know very well hypertension is number 1. Number 2 is diabetes. Number 3 is, of course, your emotional stability, being stressed. Number 4 is, of course, your, I hate to say it, your body condition, whether you're fat, and everything. Number 5, your mobility. Nag-exercise ka ba? Yan and everything. Number 6, this is really proven, your smoking and your alcohol.
Bad lifestyle habits.
Bad lifestyle habits. And of course, as sinasabi mo, pinagbabawal na gamot, no? And then, of course, yung mahalaga rin yung your health-seeking behavior. Maganda ba or what? No? It's, di ba, it's, as we always say, it's better to see a doctor when you feel that somehow it's more to check how your condition is rather than see a doctor because there's something wrong already going on. Yeah,
okay. So, mas maganda yan. Parang wag natin makita yung mga doctor, might as well na lang live a healthy lifestyle. So, Doc, ito, I'm sure, marami na I know marami na kayo na-share sa ating mga viewers, but ano pa yung pwedeng very important message that you can share sa ating viewers when we talk about locked-in syndrome?
Well, the thing is, it's a rare condition, but as I said, what I would rather share what is very practical. It's a state wherein usually caused by a condition that affects the part of the brain that is necessary for effective communication and galaw ng body natin, especially the lower parts. So, of course, to prevent this from happening is to prevent the causes, the usual causes, and number 1 is, of course, stroke. And I've already mentioned the importance of knowing what the factors are for stroke, and as we always deal nowadays, it's better preventing it rather than managing it. I know it's easier said than done, and some of us, even doctors, are sometimes guilty.
We're stubborn. Actually, feeling ko we are more stubborn patients. Okay. There you have it, mga kasambay. Marami na tayong nalaman tungkol sa locked-in syndrome. Mula po sa mga sanhi hanggang sa kung paano ito nadadiagnose at namamanage. Pero naku, wait lang, hindi pa po tapos. Kasi kahit may tamang info na tayo, may mga maling paniniwala pa rin na kumakalat tungkol dito. Mamaya ay oras na para i-debunk ang mga myths at i-set ang record straight sa magbabalik po ng Doctors on TV. Ibabalik po ang Doctors on TV. Mga kasambahay, this time, it's all about setting the record straight on locked-in syndrome. Let's bust the myths, drop the misconceptions, and get the real facts. Dito lang sa Mythbuster. Dito po natin iisa-isahin, Doc, ang mga kumakalat na paniniwala tungkol sa locked-in syndrome. At sasagutin niyo po ito, Doc, kung myth lang ba to or fact. Kung myth po ito, Doc, please explain kung ano nga ba ang tama. So, ready ka na ba, Doc?
Sure.
Okay, so ito, myth or fact? Kapag hindi makagalaw, ibig sabihin, wala nang malay.
No, it is possible na kahit hindi ka makagalaw, ay may malay ka pa rin. No, kasi ang pagkaroon ng malay ay basis malaki ang track na involved yan. Pag nai-spare yun, like as in locked-in syndrome, pwedeng mahina ang isang parte ng katawan, yet may malay siya. May awareness is preserved.
Okay, ito, Doc. Myth or fact? Hindi na nakakaramdam ng sakit o emosyon ang pasyente.
That's wrong. They can interpret, they can feel it, but how to react to it sometimes it's impaired, no? Okay. So, for example, pwedeng bigyan mo ng konting stimulus, hawakan mo, pero hindi sila makareact, respond back. So it's not a fact, no. It's a myth. It's possible that they can feel.
So basically, suppress lang yung gusto nilang response.
And of course, the basic thing is you talk to them. They can hear. They can see what's going on, but they cannot just respond properly as we can do. Okay.
Okay, so eto, myth or fact, Doc? Locked-in syndrome ay katulad lang ng pagiging paralyzed mula leeg pababa.
No, because isang example yan kasi with that is description alone, yan tinatawag ko na Superman syndrome, yung nangyari kay Christopher, na paralyzed siya sa baba. Hindi siya locked in, no? No, ang nangyari sa kanya, yung spinal cord niya ang nadali.
SCI siya, spinal cord injury.
Kasi maraming tracts ng katawan natin ang nag-govern ng paggalaw. So maaring hindi lang ang tukod ng brain na nangyayari sa locked-in syndrome ang nangyayari, maaring mas mababa pa.
Pero Doc, question, yung ba kay Christopher Reeves, could he talk before?
Oh, yes.
So difference dito sa locked-in syndrome na parang hindi nga makapag-communicate.
Kasi preserve yung lower cranial nerves niya eh. Yung spinal cord ang yung kamay niya at saka
Dapat nanonood yung mga magbo-boards medical boards kasi magandang review to, Doc. Okay? So, myth or fact, wala na talagang saysay ang buhay ng pasyente kapag may locked-in syndrome.
Is that question on the mind of the patient or the mind
or
of
the caregiver?
Caregiver. Of course, I always feel that habang buhay tayo, may saysayang ang buhay natin. May pag-asa pa rin. No, I've seen in the advent of technology nowadays, some have a brave statistic that they can last for 20 years or even more. No?
Pero Dok, hindi ba mas parang malungkot yun na parang hindi ka na nakakagalaw tapos gising ka pa ng 20?
Pero ang kanilang habol syempre is kahit papaano na-preserve yung kanilang communication skills. And of course, we're relying on the fact that they may not recover. As I said, I have had cases wherein over time they were able to retrieve some of their motor power.
Pero syempre yung age naman yung sinabi mo, Doc. Pero kunyari nag-locked-in syndrome ng mga bandang 80 o 70, tapos another 20 years.
It will depend on Kasi syempre pag
Sorry naman, kontrabida sa pelikula.
Oo nga.
Kaya lang, I'm just being realistic.
Yeah.
Doc,
Kaya
diba?
nga, as I said,
Just trying to put myself in that situation.
Whose perception is it? Is it the patient or the
That's why I said that. Okay, so ito, Doc, myth or fact? Kapag na-stroke ka, automatic pwedeng maging locked-in syndrome.
Of course not. Because the thing is, stroke can occur in various parts of the brain. The locked-in, it just happens to be a special part of the brain na ganito ang kahinanatnan. No? Halimbawa, kung ang stroke mo ay nasa taas, isang parte lang. So, isang parte ng kalahating parte ng katawan mo maaaring hindi magumalaw, at kung hindi sa tinatawag nating center na responsible for speech, pwede pa rin siya makausap and everything.
Eto, Doc, actually gusto ko na sagutin tong next, pero dapat ikaw yung guest. Myth or fact, hindi na pwedeng gamutin o alagaan ng may locked-in syndrome?
Ano ba gagawin natin bilang manggagamot? Siyempre, kahit anumang condition sila, dapat of course recognition and of course proper care, and see also how the family and the patient feels about it. But of course, we need to, because if we feel that, for example, I'm being honest, for example, ang cause ng locked-in syndrome ay may tumor na talaga medyo palaki-palaki. And of course, the prognosis is very bad there, So, as opposed to, for example, something like it's stable, it happened once, like stroke, well, chances are, let's see, maybe patient can recover.
Yeah, at saka, it's imperative that we always give our best para to show extend kindness, compassion, and care. Yeah, okay, ito, myth or fact? Ang locked-in syndrome ay palaging permanenteng condition.
Well, I already mentioned that no, not necessarily. Meron akong mga kaso na, of course, they have somehow, I would not say snapped out of it, but somehow they have their condition improved over time.
Okay, so there you have it, mga kasambahay. Malinaw na ngayon kung alin ang myth at alin ang fact pagdating po sa locked-in syndrome. Tandaan, mahalagang hindi tayo basta naniniwala sa mga haka-haka, kundi humahanap ng tamang impormasyon at kumukonsulta sa mga doktor. Maraming salamat po sa napakagaling na si Dr. Perry Noble, a neurologist from Makati Medical Center, sa pagbibigay linaw at pagtutuwid ng maling paniniwala tungkol sa locked-in syndrome. But before you wrap up, Doc, any last reminders or advice po para sa ating mga viewers?
Well, anyway, I always would like to say to my patients, of course, who I deal the most, to the family, and of course to friends, be aware. Of course, you already debunked a lot of myth. What is fact? And know about it, and spread the good fact to your friends, to your neighbors, rather than fake news.
Yeah, okay. It's very rampant nowadays. And, Doc, you might want to invite our viewers to visit you here at Makati Medical
Sure,
Center.
anytime.
Sana not for a locked-in syndrome.
And of course, I'll be willing, of course, as long as you inform my secretary.
Thank you very much for what you do, for extending kindness to all your patients. Thank you very much, and for sharing your knowledge here. Marami po talaga tayong natutulungan. Thank you. And for more information about their services here at Makati Medical Center, you may visit their website at www.makatimed.net.ph. You may also conveniently book an appointment online or reach your 24/7 hotline at 02-8888-8999. 58 po yan, 39. Stay connected to world-class healthcare anytime. Or you can visit here at Makati Medical Center, your trusted health partner. Located at number 2 Amorsolo Street, Legazpi Village, Makati City. Mga kasambahay, para po mas marami pa tayong matutunan, stay tuned dahil magbabalik po ang Doctors on TV. Welcome back, mga kasambahay! Kanina po ay tinalakay natin ang locked-in syndrome, isang rare pero life-changing na kondisyon kung saan alerto ang utak pero limitado ang galaw ng katawan. Kaya tandaan, hindi lamang gamot ang susi, pati malasakit at suporta ng pamilya ay napakalaking tulong sa kanilang pagbangon. And of course, gusto ko din pong pasalamatan ng mga taong patuloy na nagbibigay ng inspirasyon at suporta sa amin pong public service mission. Kuya Daniel Razon, maraming salamat sa inyong walang sawang dedikasyon sa tunay na public service. And to BMPI's General Manager, Mr. J. Eusebio, may you both be blessed with good health and continued success. At syempre binabati din natin si VP Nolly, VP Bong, VP Joseph, VP Jerry, VP Ruth, Doctors on TV production team, ang Public Service Department at ang KDR Group of Companies. And also binabati ko yung aking kambal, hi Iyo, Iya, and EJ, hi kay Dr. Aline at sa mga pasyente po natin sa Barbaca Budil Health and Wellness Center. Also, greetings go to Delicates Food Corporation, headed by Mr. and Mrs. Jonathan Mooney and the hi kay Tita Letty Duarte and kay Deng. And of course, Nanay and Tatay, I love and miss you both so much. And Nanay, happy birthday in heaven. At sa atin pong health partners, Doctors on TV would like to thank Makati Medical Center Incorporated, located at Quezon Avenue, corner Scout Magbanwa Street, Barangay Paligsahan, Quezon City. You may contact their trunk line numbers 0283723825 or 0253185100. And their mobile number 0919-069-1890 or 0919-069-1891. You may also visit their website at www.capitalmedical.com.ph. And also, we would like to thank Surgeon General Hospital. For inquiries, you may visit their website at www.sgh.doh.gov.ph. Doctors on TV would also like to thank River Valley Eye Center and Specialty Clinics Incorporated. For inquiries, you may visit their website at www.rivervalleyecsc.com. At kung gusto niyo pong balikan ang mga segments today o i-share sa mga kaibigan ninyong healthy living advocates, pwede po. Just visit our social media pages, www.facebook.com/doctorsontv and hit that subscribe button on YouTube at www.youtube.com/@UNTV News and Rescue para lagi po kayong una sa health info. At huwag pong kalimutang tumutok ulit next Sunday mga kasambahay, 9 a.m. Sunday 9 a.m. dito lamang po sa UNTV. And also, don't forget to like and follow my Facebook page. Just type Dr. Sara Barbaca Budil in the search box. Muli po, magandang umaga at maraming salamat sa inyong lahat na nakisama sa isa na namang makabuluhang talakayan tungkol po sa kalusugan. Ako po si Dr. Sara Barbaca Budil. At laging paalala namin, let's make it a habit to learn about good health. Only here at Doctors on TV.
Doctors on TV would like to thank Makati Medical Center, the hospital with the heart, located at Amorsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867, 02-824-9360, or you can email them at lgcsalesco@gmail.com. Pro Biomed Care Incorporated, PB Med Doctors Clinic, located at Parañaque City, Ruiz Building, 365 El Grande Avenue, BF Homes, Parañaque City. You may contact them at 0943-0533-040 or 0917-8967-955. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barbaca Budil Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Special thanks to Makati Medical Center, Dr. Saturnino P. Javier, Medical Director, Interim Co-President and CEO, Mr. Arnold C. Ocampo, Chief Finance Officer, Interim Co-President and CEO, Ms. Arlene L. Songko, Senior Vice President, Ms. Monica Reyes Dizon, Assistant Vice President, Mr. Mark Punelas, Makati Medical Center Unit Head Manager, Communications and Special Projects,